The event is going to be recorded. Hello and welcome to our today's launch event, Transportation Access Among African Diaspora Communities in Washington State, with focus on King, Snohomish, and Pierce counties. We thank you all very much for your time, for your interest in today's event. We are very excited. For those of you who did not have received the agenda, we will start with a bit of introduction. Then my colleagues will present the findings and major highlights of the research. And at the end of the presentation, we will have the Q&A session and kind of an open space, I would say, for everybody to share their thoughts, to ask questions and to interact with the researchers, or if they have any community inputs, because we will have the community leaders with us in the WASCAL team, our partner organization who helped us conducting this research. We are very grateful for the amazing work that they did during the project. The full report will be published on our website in social media tomorrow morning. Please take a moment to write down your name, your organization, role, and your email address. A direct link to the full report will be emailed to you all as soon as the report is uploaded on the website by our IT team. Now, a bit of introduction about our team and Porsesh Policy Research Institute before we kick off, and I see the guests are coming in. So Porsesh Policy Research Institute, or PR, is an independent nonprofit community-centered research institute based in Washington State, dedicated to producing fact-based analysis that drive impactful interventions, programs, services, and solutions. We are committed to impartiality, employing a human-centered design approach, emphasizing on the value of contextualized knowledge to better serve communities. PR primarily focuses on underserved communities and vulnerable populations. PR is founded in 2022 in Washington State. It was established with the vision of a world where no one's dignity or rights are compromised in social decision-making and service delivery due to misinformation, disinformation, or lack of systematic information. Today, PR remains steadfast in its mission to deliver evidence-based insights that inform policies, programs, and services to tackle critical community challenges. Again, welcome to our today's event. We are very grateful for your time, and thank you all so very much. My name is Ehsan Shaiban. I'm part of the research team. I'm leading the institution as president of the organization, and also I have had the honor to work on this research report with my brilliant colleagues, Tasi and Anna. They have been working on this report for about 7 to 8 or 9 months, I would say. And the report is completed. We are going to launch it. We are going to publish the report, the full report, tomorrow morning on the website and on our social media channels. And we will email the link to the full report tomorrow. Without any further ado, I want to invite my brilliant colleagues, Tasi and Anna, to take over. Thank you all so very much.
Yeah, hello. Thank you, Ehsan, for introducing us. It's been a great project, and I've learned a lot from it as well. Just from some introduction, my name is Anna Erickson. I am a second-year Master of Public Health student at the University of Washington, focusing on environmental health sciences. And most of my work examines how climate change influences public health policy and community resilience. And I focus on a lot of equity and systems-based approaches. I'm really passionate about centering and amplifying community voices for local environmental and social justice issues. And I have a strong background in qualitative data analysis and community-based participatory research. And yeah, besides my work, you can find me beachcombing, rock hounding, and occasionally scuba diving around the Pacific Northwest.
Yeah, thank you for such a kind introduction, San. My name is Tassie Jones. I'm also a second year Master's of Public Health student at the University of Washington. And a lot of my data or my research kind of centers around Indigenous data, specifically like small data sets that's usually not captured by like mainstream research. And I guess through this project, I've also developed a really big affection for transportation and the amazing amount of data actually in that field. And outside of this, I usually work on my car, so I can't get away from transportation.
And all right, now that introductions are over, I guess we're gonna go get right into our presentation about everything that we did. So give me 1 second to share my screen here. All right, we can see. Kelsey, can you nod for me? Okay, perfect. Awesome. So yes, this is our study on transportation access among Washington State African diaspora communities.
So this project really couldn't have been possible without Cockle, who and Martha, of course, who really helped coordinate like interacting with the community and setting up all of these events through data collection, to support our data collection. So we had sort of a three-pronged approach to it, two of which occurred with all of these community events. So we had community conversations that were led by Anna, and that was really focused on gathering qualitative data. So bringing up in front of the community, like, how do you feel about, transportation and what are your concerns? Those sorts of questions, really to just get a sense, like a temperature check. To support that, there was also a really quick survey that really gathered up some information on demographics that was shaped sort of by the census and also pre-existing data that tends to be used for ridership surveys. And that was focused on getting kind of like actionable numbers to support what we were seeing. We also did this thing called geospatial analysis, and very nerdy, but it's looking at data and the way that people move and use certain resources like bus stops, and what is available where a lot of our participants are. One of the things that we also did was go out into the field, and after we heard reports about certain bus stops or routes, decided to take a look and photograph the conditions there. Next. So when we began this project, we had a few priority populations, which were like the elderly, the youth, and individuals with disabilities, particularly like mobile disabilities. So we ended up reaching a total of 367 people, which is pretty amazing. And actually a substantial amount of this was in person. And these events occurred all throughout kind of primarily the north to south corridor. And we engaged about 13.4% children. I think about 31.7% of the total peer study population was children, which was really great to get that sort of representation. Elders comprised 13.9%, and recent immigrants, another study priority population, comprised 51.5% of the total population, which was really great to see, just because, I think a lot of times when it comes to community engagement, it's most accessible for people who've been settled in an area for a long time. So really kind of hoping to get voices that aren't otherwise normally seen. And we compared this against the census data for sort of these areas. And we do have overrepresentation, which is good. So we're getting a little bit more of those voices that might not necessarily be cataloged.
Yeah, so now I'm going to dive us into the findings a little bit. There were 5 major themes that came from our findings in both our survey and our community conversation interviews. The first one was safety and perceived violence, which sought to understand participants perceived an actual threat of violence while using any type of transportation mode. It's also important to note that safety was also a sub-theme throughout all of the themes. Every bit of it kind of talked a little bit about different types of safety, and we can get into that, but some of that's like, oh, the actual threat of violence versus there's not enough lighting at a bus stop and it makes me feel unsafe because I can't, the visibility's not good. So we did classify different types of safety within the study. And then another major theme was transit amenities and customer experience. So it sought to capture the reasons why transit users might experience added stress on public transportation, or what their decision making really was in taking public transportation, why they chose to take a train over a bus or an Uber to a train station, things like that. And it also included other interactions with customers or transit staff, the condition and location of shelters or bus shelters or transit stops in general, and the general cleanliness of transit. Then we had transit system design and reliability. So that captured a lot more of the infrastructural components, like coverage of an area, scheduling, navigability of just the system as a whole, and what frequency were people or were transit area, or if the frequency of transit met the needs for the area that people were talking about. Then we also had opportunities and convenience. So it captured how participants really engaged with public transportation in response to barriers like on your way to work, a medical appointment, a cultural or religious event, or even grocery stores. So how did public transportation factor into people's daily lives? And then we also had a theme which specifically was for more of the diaspora responses that we had that were very comparative to, oh, here versus what my experience or what participants' experiences were within within being part of a diaspora community and figuring out public transportation. So yeah, this captured experiences that specifically belong to immigrants and refugees, including language barriers, cultural barriers, and just understanding of the public transportation system and how that changed over time with people or with residency here. So as I mentioned earlier, or just briefly, safety was the most urgent and consistently mentioned concern. I had questions to ask about it in community conversations. Participants typically brought it up, or every single time actually, brought up safety concerns before I was even able to ask questions on it. So it was on the forefront of a lot of participants' minds. And then we also found that through our study with figuring out what dynamics play into feelings of safety, we found that media coverage of violence on transit often creates an avoidance of public transit, which was an interesting little note to come out of this study. And then riders also expressed a desire for security presence, but preferred non-police officers, such as the transit specific security and the transit security officers. I believe they're acronym TSOs. Then participants, especially women, elders, people with disabilities, and families, reported experiencing or witnessing violence, drug use, and harassment on or around public transportation stops or modes of transportation themselves. And then they also expressed feeling unsafe near unhoused populations, especially where there are tents or groups loitering very close to bus stops or transit stops. And there was a lot of concern about exposure to drug use, particularly with children present. And some of the qualitative stories that we got was this one was very interesting to me, was it often feels like taking public transportation is a one-way ticket to robbery or harassment. Um, sorry. And that is a statement about how people are really feeling about it. And it's, if people aren't comfortable taking public transportation, then no matter what you invest in it, then they might just not take it. So definitely a lot of animosity and feelings towards there. Another respondent in a community conversation said that getting on the bus is scary, especially when going through the downtown corridors. There are people on the bus doing drugs or just completely zoned out. Sorry. And then this person was with their daughter, and she was 11, and she even knows what fentanyl smells like, which is a big issue to have. Apologies. Tossie, could you grab this?
Yeah. So one of the things that came up was a lot of participants were noticing that there's significant disparities between neighborhoods in terms of like shelving, seating, and cleanliness. This particularly is mentioned like up in Linwood, and how nice some of the bus stops were, for example, like in Northgate and slightly up north, whereas the farther down south there was a lot of feelings that, you know, there isn't anywhere to sit, and it's cold and it's wet here in Washington. So particularly in the winter time when you're waiting for 30 minutes between each bus, that difference is really noticeable to people. A lot of the elderly and disabled riders, for example, mentioned that like seating was an issue. So was the sidewalks themselves. For example, when it rains, even if there is like an accessibility curb, those still fill with like puddles and leaves, and they fill rather quickly. So one of the quotes here was, here in Shoreline or Lakewood, there are bus stops with some shade, even though it can be cold, but still I won't get wet, if you know what I mean. Let's say where I come from, Central District. For me to catch the first bus, I need to walk like 18 minutes to catch the first bus. What if it's raining? I need to go to work. I need to do my stuff. What can I do? And so this sentiment, this quote really captures it quite well, but this is a really common sentiment regardless, is just, you know, especially in areas where you're waiting for 30 minutes an hour for these buses, it really starts to add up. Next one, please. So as part of this, one of the things we did was we went out into the field after kind of getting a sense of what stops and routes people were taking and areas that really had like a large amount of participants in them. So one of the ones that we went to was down in Tukwila on Route 128, stop 41, 122. And so this one was very interesting to see. It was about like a mile or two straight of no sidewalks and multiple stops like this. So you had to walk along the shoulder of the road, and cars are going probably about, I'm not sure if they're supposed to, but it felt like 40. So there weren't any crosswalks. It was a little bit of a quick sprint across the road. And in the center, you can actually see how waterlogged some of the areas are to even get to some of these stops. And it was actually, while I was there waiting for another bus on some very nice person's lawn where the stop was actually located, a child was trying to avoid the puddle and fell in there. Just to showcase sort of the difference in amenities. Here in Linwood is another stop that Anna took a picture of. And so there are like seating, but for example, if you use a wheelchair, there's not a lot of clearance area. And still, again, it's very wet up here. So the lack of shelter is another big participant concern. Next slide, please. Something people also talked about was like the difference in these facilities. And Anna went up there and she noted, she was texting me while she was taking these pictures, and she's like, there's like 5 stops in a row and they're all so different looking. And I'm not sure, like, you know, why they're so different and what the reason is. And some of this has to do with different jurisdictions, different route levels. But it is funny to note that even as people who've been researching for this for a few months, I think especially for like the average lay person, it's a little bit confusing why there is this difference, even if some of it just has to do with local advocacy. I think transparency around the decision making for these amenities is something that participants really expressed a desire to understand.
Yeah, and I just want to note real quickly that in this slide, the one on the far right, the other blue one, was in that line, and in the background, you can see the bus stopped by the picture on the bus stop to the picture on the right here. Well, this does serve the orange line, which is a more frequented line. The bus stops are within sight of each other, and just the drastic difference between amenities at them was very notable. So we just wanted to highlight that. Also, for customer service, interactions with staff and other drivers were mostly positive. There is always a need for continued support and training, specifically for people coming from different language groups. I apologize. Oh my gosh. First try. And affordability was also a reoccurring concern, especially for recent immigrants and refugees who expressed confusion around fare systems and transfers. So a lot of them end up actually paying more than necessary, which can be a huge financial burden in the future.
One thing to note about that was a lot of the children reports. So kids are allowed to have like kids have free fare with like Orcalis and things like that. So if you're under 18, you have access to the trains, the buses. And so a surprising amount, I think it was 25%, even though it's a small sample size, 25% of youth that were here for about 3 years or less did not know that they had access to free fare. And so we're spending like upwards of $100 a month on transportation itself.
So yeah, some of the most common complaints regarding design and reliability were low transit frequency and late or just missing buses. A lot of this happened because buses especially at really busy service hours, they often bunch where several would arrive at once, which created a bunch of gaps in service. Participants also reported waiting 30 to 60 minutes, especially during evenings, like at high traffic times and on weekends specifically when there are just less transfers and routes available. And then high frequency, which is how many times a bus is coming an hour. So I believe, correct me if I'm wrong, Tassi, higher frequency is a bus comes every 15 minutes, whereas lower is 30 minutes to an hour. And so high frequency transit is really geographically uneven with a South and East Seattle and rural communities underserved. So yeah, essentially the further south and east you go, the less frequently buses show up anyway, even if there is still just as much of a demand in more northern areas or western areas. Specifically, some really highly served areas are like U District, for example, around there, and over, oh my gosh, I'm forgetting the name, but over like in West Seattle and in downtown. But rural areas were also very underserved as well, which makes sense. As there's less of a population there, it would be less of a service priority. So then almost at every single community conversation, I would have people shouting out specific routes, which they described as difficult or to access or unreliable. And this was really important because it highlighted a lot of places where people just, because a lot of these were the same routes mentioned throughout multiple different community conversations. So it really highlights some of the some of the places where people are really struggling more than others to get to where they need to be. And this also was really good because just the community aspect of sharing out and describing what their problems were and where they were was really good at engaging participants in local advocacy, essentially. So we were able to use this as a bit of a education component of, oh, here's who you contact if you would like this bus stop here or this route to, if you have a complaint for that. So yeah, that was also something we found through there. And then, yeah, participants really had difficulty with transfers, especially with counties or at major transit hubs where there is a lot going on. A lot of this difficulty was surrounding which bus to take, potential language barriers that they're working through, and just understanding navigability of the maps and the systems. There were also other physical access barriers, such as inadequate sidewalks, as we saw in Tassi's lovely photos, and her story of the poor child falling in the puddle. But also unsafe or poorly maintained infrastructure, so infrastructure that needs to be updated or just needs to have increased visibility or better shelters. And then really long walking distance from bus stops was another one. We had a decent amount of people who'd have to walk 30 to 60 minutes to or from their bus stop to get on their commute to get to work, which is a long time to be spending walking around outside, especially if there's inclement weather as well. And then reduced service after 6 p.m. often leaves people feeling stranded or unsafe, especially women and shift workers. We found this increased during the winter time, like now when we're commuting in the dark or we're going to work in the dark, coming back from work in the dark, because it gets dark so early. It's visibility is really important, and then also, yeah, just if you're in a more rural area, if you're the only person waiting at your bus stop for 30 minutes, it can't, especially for women or elders or people who might have trouble physically defending themselves, that might cause a lot more anxiety. And then opportunity and convenience. So public transit often really fails to align with work, medical, or religious schedules, particularly due to those long distance from bus stops. There's some inconsistent early morning service. In particular, members of this of the African diaspora community, there are certain there are certain sub-communities within that that will wake up at or will go to church at sometimes at 3 or 4 a.m. and there just isn't a bus running at that time. So it's really a lot harder for elderly people to get to where they need to go on early morning services as well, because they don't. A lot of elders expressed that they didn't have any other means of getting there besides bus. And then there was a lot of infrequency in routes in rural or underserved zip codes. So first and last mile issues, like long walks, bad weather, were the most common reasons for missed appointments or late arrivals. So it seems that once people are able to get on transportation, it's not that bad, but getting to and getting from it have caused a lot of issues and just make it hard for people to get to the things they need to. And then some transportation users opted to walk, carpool, or use ride shares like Uber or Lyft due to long wait times or inefficient routes. And that puts people at a lot higher cost. And some people also aren't able to do that because it does cost extra money. So one participant in particular described really well in a community conversation about how when they first arrived here in the US, they had to use public transportation, really struggled with it, had to get a bike, and then as they were here over time, they started using ride shares. They eventually started being able to carpool with friends, and then eventually got their own car. So there is this shift that as financial stability increases, or just financial resources increase in general, people do shift, or members of the diaspora community often shift to using more private transportation. And then, so that is also probably a influence on that. And then participants often relied on multiple modes of transportation, so taking the bus, then walking or biking, maybe taking the bus to take the train, due to system gaps. So a lot of people are doing a lot of extra work trying to get to their destinations, and bus and transit lines aren't necessarily delivering them to locations that are very close to where they need to go. And then this map here is a map of where respondent. Oh, Tassi, would you like to?
I can take over. So it's a lot larger in the report. It's a little bit more legible. This is for mainly illustrative purposes, but it shows sort of participant desire for like routes closer to home or stops closer to home. Basically, by the respondents in the area, how many people said please, please. And then I also relayed sort of kind of where transit routes are. But you can kind of see what you would expect to see is that kind of the farther you go out from more urban centers, the more people are kind of like wanting access, and there might not necessarily be a strong access to routes close to home. Something interesting to see though is the areas where a large amount of respondents, even in like the more urban Seattle area, still really wanted stops closer to home. We go into this a little bit more in the discussions of how this can be leveraged by the community, but this was just sort of taking this feedback and visualizing it to show how those overlap, that desire with what exists.
Yeah, and then so now we're getting into a little bit of cultural differences and understanding of just the public transportation system. That goes a lot with education and outreach. So a lot of recent immigrants and refugees reported struggling with language barriers and understanding fare systems, transfers, and transit social cultural norms. And a lot of that is because of language barriers, and then also inconsistent enforcement of fares added to confusion. So somebody might hop on a bus one day and not get asked to pay or not have to pay, and then they might keep doing that until a bus driver or some other transit staff stops them and asks for payment, and then there's the confusion of, well, I was hopping on here anyway, why do I have to pay now? Or so there's just some inconsistencies with that, and that can cause some of that extra confusion. Substance abuse issues were very frightening to a lot of newcomers who were unfamiliar with such issues, especially in public spaces. We had a lot of more recent immigrants and refugees talking to us about how they didn't really know how to handle some of these situations, and they didn't know, not situations, but they didn't know how to handle people who were in a mental health crisis or on drugs. They had never experienced any of that, and that was very scary for them. And so one of the participants said, or describes it pretty well. For the guy coming into the city for just the first time taking the bus, does he really know what's going on? You know, whether this is a drug crisis or is this a mental health crisis? We can't tell the difference between that. Is this person trying to be nice to us, or are they trying to lie to us? We can't tell between that. So while yeah, while we're not asking them to become mental health or drug experts, but just the exposure to it is something that they're often not used to. And we did have a couple conversations with people where they mentioned, back in my home country, this doesn't happen. So it's one of those systemic issues that comes to a new place. But there is a lot of uncertainty and fear around that. And then, as I mentioned earlier, longer-term immigrants described a shift from reliance on public transportation to personal vehicles as their financial circumstances improved, which is great. Financial circumstances improve, but we also want to improve the public transportation system so that there's less of that big transition. Right, and now we finally have reached our recommendations. So when it comes to safety and perceived violence, we recommend it, which this aligns with a lot of, both Seattle and Washington State Department of Transportation initiatives and just hiring. I get the notifications from you guys whenever you guys post a job, and there's been a lot of security officer positions I've seen. And so, yeah, expanding trained non-police security personnel, even to bus routes, might be beneficial in just helping provide a sense of security while you're on a bus, while people are on a bus, or just some person to go to in case they also need help navigating, because we did find that bus drivers and transit security officers were the first people that a lot our participants went to whenever they had a question about navigating transit or just any transit related question in general. So they are also a great information source for people. Then we also recommend improving lighting, visibility, and cleanliness at underserved stops. And that will also improve feelings of comfort and safety as well. Potentially also installing call boxes or panic buttons in lower traffic areas might also give a increased sense of comfort, safety, and security to participants, especially for the more winter months when it's darker out a lot quicker. And even if this it doesn't necessarily directly calls 911, and it goes instead to some personnel that is experienced in emergency or mental health things, it would still just absolutely help improve safety around bus stops. And then we also suggest partnering with mental health and other outreach groups as well. And this will just help improve communities as a whole. A lot of collaborative approaches are really good at increasing safety, getting people out there who know how to help people who might be in need around some of these stops. And yeah.
One of the things related to infrastructure and amenities was just standardizing shelters and seating across zip codes. So prioritizing higher need areas, just because the impact of not having access to, like seating or coverage is a little bit stronger when there's a higher reliance on the public transportation system. Updating sidewalks to be ADA compliant and weather safe, just thinking about Route 128 and the fact that there really were no sidewalks. Or like you can see here in the picture on the right, another stop on Route 128. This also is not super accessible either, and it was pouring that day. Increasing amenities, so benches, real-time information, trash cans, just to assist like navigation while you're there already. And then also transparency on how communities can get engaged. That was one of the biggest, one of the things that we saw as well, was a lot of people like, I didn't know we could complain, or I didn't know we could do this or we could do that. And WashDOT has kind of like a new, for 2025, community engagement plan. that talks a lot about like areas at which like communities can get engaged and methods for that. And I think one, making sure that information gets out there, and then also just communities supporting each other through like coalitions and things like that can be incredibly helpful. Next slide, please.
Yeah, so in regards to reliability and access, we recommend looking into increasing frequency in South King County and East King County, in not even King County, but just southeast greater Seattle area. We'd also recommend trying to improve transfer coordination and on-time performance, which is always a metric public transportation I feel like is always trying to improve on, so that those kind of align with a lot of WSDOT goals and just other greater transportation goals as well. And then we also recommend adding stops closer to residential areas with unsafe or inaccessible routes. So we're trying to reduce some of those first and last mile problems that a lot of people encounter, where they might have to walk 30 to 60 minutes to get home from a major or a major route, or there isn't public transportation options to even transfer to their home, so they have to walk or bike. And then we also suggest expanding first and last mile support, such as microtransit, like bike shares, community vans, especially around, especially during winter time and when it's dark. Community vans during commute times could be really beneficial to just dropping people off in areas where bus routes or other major transit routes aren't servicing as much. And then in regards to cultural inclusion and language access, we recommend providing multilingual materials in a bunch of high need languages. We have a language map here of the most spoken languages in our study. Not many of, I think English and French were the ones, Tassi, you can correct me if I'm wrong, that were already in the big list of languages that were translated, but like Lingala, Tigrinya, all those languages, I believe you have to request to get translated, but I think the request button is even in English.
Yeah, so there's different levels of language accessibility. There's things that are proactively translated. There's things where they're like partially translated, like certain resources, and then there are ones where you have to specifically request. And a lot of this is based off of kind of like population, like census data, which is why it's important to respond to the census. But the problem with this is that unfortunately, like if you are like from a smaller community, like for example, I'm Chamorro, which is an indigenous group from the Micronesia. A lot of these languages are not automatically translated, and in order to even get to the page, it's a little bit buried between several different Google searches. And so to do that whole process, it is really important that you are able to speak English, which is a little counterintuitive. And all of this is, again, like in written formats, rather than audio or visual ones, which might be more useful, for example, if you have elders who don't read or write.
Yeah, that was a big part of the feedback, was especially for elders or recent immigrants who can't or aren't literate in English. That not just getting written instructions and format, but also audio or visual ones or translations can really assist. And that also extends to anybody with disabilities as well. If it's hearing or eyesight related, that also just helps. It helps be ADA compliant. It helps people out just in general to understand what's going on. And it's really important too. So yeah, communities can also follow resources provided in the supplemental materials of this study for how to request the or language translations. We did want to leave that in there as a just a pathway. But yeah, so we also suggest deploying community navigators and multilingual staff support at major transportation hubs. And this could be like, I don't know, similar to those call buttons or something that has like a translation service in it. You don't necessarily have to have people there, but just trying to provide more communication paths is a really good way to go about it. And then we also suggest improving wayfinding, signage, and education of fare systems and transfers. This can be done both in partnerships with community organizations. You got hosting an educational event or workshop is always a really good idea. And we found we had a lot of success just sharing information through our community conversation events. But also some of the maps and navigation stuff that are not online based. Again, thinking particularly of people who might not have a smartphone or elders who might not use a smartphone in general. So a lot of the signage is kind of going out of date, or you have QR codes, and that can also be really inaccessible to people who don't have access to the internet. And they're trying to find their way around as well. Um, and then also train or hire some drivers or staff to support elders and limited English speakers as well, and try to really advertise it and make it super easy for people to access. Because I think that's one of the bigger issues regarding language access is that it's just hard to get to. And yeah, so this could include expanding some services, redoing some websites. Um, but yeah, it's really adding more diversity to staff so that you can support more diverse population. So then in regards to affordability and equity, we also suggest increasing community awareness of transportation resources. So again, those community partnerships or education events could really help with this. And yeah, assisting elders and LEP individuals with registration could also be or would also really help just remove some of those barriers to filling out some of those forms and other things that are really beneficial for people to know. Tassie, would you like to talk about the Orca Lift program?
Yeah, I was just there's the Orca Lift, which is for low-income adults. There's also the Orca Youth, which is for youth, as is in the name. And so these are just transportation resources that allow people to use the bus and the train for free or incredibly reduced costs. During one or two community events, we had some additional pamphlets, and it had some people from HopeLink come in to talk about this stuff. And it's really great resources. I'm from Texas. We don't usually have this sort of thing. But I think that sometimes a lot of people just don't know that they exist, and sometimes that's just comes down to like marketing or kind of the news channels you're in. But yeah, it's just another example of a really great resource in the area.
Yeah, and we also recommend just to help combat some of the more besides just the educational programs, to combat some of the more confusing things that might come up. We also recommend ensuring equitable, non-punitive fare enforcement practices. So making sure people are paying their fares, but also paying the fare they should be paying. Not like double paying for some buses like a lot of people do, or getting bus rides for free per se, but like helping them figure out what is a good financial strategy to or financial strategy to use the bus services, and then also keeping the, or yeah, ensuring that it's consistent. There we go. That's the word I was looking for.
Yeah, so kind of in summary, because we threw a lot of different things out there, is that across all demographics, community members were really invested in improving like safety, reliability, and accessibility. And those were kind of like the key issues across like frequent riders and infrequent riders, is just that in order to do it, you need to have the resources and it needs to be there when you need it to be there. You need to feel safe being there too. This isn't, necessarily new news, but it is really important that we get it down and we kind of get the word out there that this is, an issue being seen in the community as well. This is a lot of talk about areas like gaps in the system, but we also want to highlight some of the really important things like community strengths, for example, like the community networks. Everyone was carpooling, like a lot of the youth carpooled together, and a lot of younger individuals mentioned that they frequently support like elders in their family with using transportation access. And so there's also a strong desire for advocacy and to get engaged in these processes to get better access and make things better. And so that was one of the really big highlights, and one of the things we think that people should really take away as well. There is, also many disparities that exist in terms of service quality and infrastructure. And I know frequently we use the argument of like, oh, well, only 7% of the Washington state in general has access to transportation that is high frequency. But one thing to consider is that, this has disproportionate impacts on different people coming from different resources. So really keeping that in mind when it comes to equity-based planning. Another thing is that language and cultural barriers persist, particularly because so many routes to improve access are still gatekept between like written resources or following 5-7 links all the way down and still having to be able to speak English. Community navigators are, again, a really great way of, relying on these community strengths and leveraging those connections. But addressing all of this really does require targeted equity investments. There's the HEAL Act, recent transportation acts through WashDOT that are a big priority for equity. And hopefully, as they encourage like community engagement and reach new phases of planning for the bienniums, there's a lot of room for community engagement. There's also, on that topic, the need to do accessible community engagement, not just I'm sending a survey out or here's a QR code or things like that. It's really important to canvas and, again, connect with communities. It sounds like a broken record, but it's so true. That in order to truly get engagement from communities, it's not just like a postcard in the mail. It does require like on the ground canvassing. Otherwise, you're missing out on the people that, would be the most impacted or might need the most access to it. Something that also came up is that, a lot of improvements are driven in the conversations we've had with like members of like transportation planning. A lot of it has to be like community driven and people have to really strongly advocate for it. And I think that it's especially important that avenues for that are made transparent because there's so many overlapping jurisdictions, but also, it's transparent. And also I think that there's support for equitable engagement with it. For example, like not only knowing what grants are out there and ensuring that communities get to know what grants are out there, but also providing support of like, here's what's expected. Email me and we can meet and talk about your application or things like that. So it's really critical that when we talk about community engagement, it really is centered on dialogue as opposed to just these resources exist. And next slide, please. So that's kind of the bulk of the report. This refers to what can be used from the report and some of the supplemental materials that are going to be provided to the community. One of the things we talked a lot about is how these findings can be leveraged. So WashDOT has consolidated grants and SDOT. This is more down the line, but it's based off of a lot of community feedback, has transit spot improvement program. So this is smaller amounts of money that go towards things like, for example, improving bus shelters. And this is a little bit more of an easy entry point than just saying fix it all. And so we're hoping that the findings from the report provides like really specific data and illustrative like lived experience to bring to these sorts of like planning focused community engagement events that are already being thrown or that are being planned by transportation groups. We're hoping that can be applied for things like the Tasker Center for Accessible Technology. They focus a lot on cataloging. They have this project called OS Connect, which is documenting sidewalk quality, which is particularly important as we saw in some of those photographs. And they have this thing called the Specialized Community-Led Impact Opportunity Grant. And so data from this can sort of support applications for these grants. Also just having things to bring that are very particular to in this one zip code or within this population living in Central District, Seattle, for elders, here is the top concern. Next slide, please. To pull back the curtain a little bit on how we got this data, just so there's a little bit more transparency. So geospatial analysis is, you can kind of see the mess on my computer on the right. It's a way of, what we did was we mapped out our respondents based off of also available data from the Washington Department of Health. So they have this thing called the Overburdened Community Score. And this is related to like job access, healthcare access, environmental exposures, and sort of like historical issues such as redlining. So one of the things in the supplementals that we provided was it shows kind of like where participant groups, particularly like large amounts of participants, overlap with these sorts of areas. One thing to note is that when people say, you know, transit, I feel really unsafe, example for this area, we have like the zip code of where people are. This doesn't necessarily mean that it is exactly where they've always been or where they're thinking about when they're talking about this issue, but we still think it's important to highlight and catalog it this way because it provides like a good starting point for further investigation. But yeah, this just helps visualize needs across area. Next slide, please. Within the supplementals, this is kind of illustrating what I'm talking about, how it's broken down by zip code, the county, and then like healthcare access, priorities. So that way it's a little bit more granular and you know, community needs aren't necessarily lost in this overall aggregate. Next one, please. And for example, this is desire for transit frequency by availability. And so it kind of maps areas where there's high transit frequency that's available and then where people actually really wanted it. So it allows kind of targeted bringing up like when you're going to events or like these sort of solicitation feedback forms to say, oh, well, I'm in like zip code, blah, blah, blah. And, you know, 70 people said XYZ, just to provide additional data and specificity behind claims. As part of the supplemental materials, there's also kind of like a list of relevant grants and budget items, and then related organizations for linkage, just because we've, you know, I think communities are important, you know, areas where you can work together with other communities as well for a shared goal is really the best way of, you know, getting it done, especially with bureaucracy, the more voices behind an issue. So these are supplemental materials. It's really important, you know, that the community has data ownership and data protection, especially when you have zip codes where there are only like 3 or 4 people. So we really encourage you, if you have an interest in working on this together, to go straight to the community as opposed to coming to us to be like, oh, what is the data on this? You know, that's, we're just the tools. They're the main drivers, and we want to make sure that they're not skipped over in anything. So this packet will also be going to Wisconsin, who's been so amazing throughout this whole process. And hopefully that will provide like more of the nitty gritty as well. Yeah, thank you guys so much for sitting through.
Yeah, I know we threw a lot of information at you guys, but we are here to answer any question you guys might have. We can also leave our emails in the chat or with you guys. We'll probably send them with the packet for those who signed up, in case you guys have any further questions about the report itself. But yeah, and now it's time to open it up.
Excellent. Thank you guys so much. Fantastic. Appreciate it. Yeah, anybody who wants to ask any question or want to comment or share any insight, please feel free to unmute yourself and just speak up. Thank you. Appreciate it.
Hi, this is Lena with Wasco. I have two comments or one suggestion. There's a King County, I believe it's Metro Flex. Are you guys aware of that? I think my suggestion to expand the services for Metro Flex, not only by city, but also by address, by zip code. And that can be helpful as far as for safety for people to get from one end to another. Oops. Another suggestion is that, or comment, by listening the language access, and the language was translated. For me, it's interesting because I think what I understood was based from the census. Is that correct? That means
Yeah.
if it's from the census, the majority of the language was translated that the people who registered for census. And there's a lot of newcomers who needs those language translations. They're not registered to census, especially, it doesn't matter where they're coming from, either immigrants, that means they were completely left out if that data of what was translated was based on census. So for me personally, I think we should kind of look into that more, because we are leaving a lot of group of people who are not registered in census, newly arrived immigrants. And I think you mentioned about navigation, partner with the communities, organization, community leaders. Once upon a time, used to be those who come in as a refugee, they will use different organization, example, REWA and many others, and they will have navigator who will teach newly arrived how to take buses, how to use apps. And I think we should be a continuation of that program, partnering with the same organization, like, for example, WASCO, to teach their immigrant communities to use the same kind of navigation system. And another one is that I believe is called reflective safety vest. I think there should be also a way of also partner with the same organization to be able to buy those kind of jackets, which can be maybe a quick solution, so that those community member who are going to take buses late, they will be able to be wearing those jackets and to be seen for safety. Thank you.
Thank you so much. Those are really insightful, and it's I really agree with you about how, unfortunately, when we make decisions off of certain data. The people that we're leaving out. I agree. That's one of the really difficult things about using the census as sort of like the foundation for a lot of decision making. Is it works great for a lot of people, but oftentimes it doesn't really center the margins. And I love your comment about, you know, reaching out to historic connections and leveraging those existing resources. There's a lot of lessons to be learned, I think, when rather than just starting from new every single time. Thank you so much.
And also one thing about the language, Tasi, the graph that you presented, I think Lina's question is basically, is it entirely from census or the data we have?
So that graph is based off of what we have. And the supplemental also includes some of like the top languages that noted that they have language barriers to access. But so the presentation and the stuff in our report is drawn from our survey and the survey responses themselves. And then the way that WASH.dot and S.dot does it, from what I understand, is it's based off of like the top languages in use in certain areas that determine like what gets translated.
Yeah, and I think this is a stage where we can talk like, you know, how critical this data of like, you know, coming from the communities are. I think there is so much missing in these communities, not really about not just among the immigrants, but among so many other populations like seniors and youth. We see a lot of missing data, and I hope like, you know, works like this can somehow contribute to filling those gaps. I agree with Lina, like, you know, there are so many things happening in the communities. We don't have any really updated data. I was looking into some of the stats for about 20 years in the King County area. I know there is a huge and enormous changes in the demographical. There's been a huge demographic shift in the King County or Washington State overall. And then I was looking for the data. You don't have a lot of data, to be honest. And I was surprised, like, to see that how services are designed, like, you know, I don't know, like, what are some of the mechanisms within the service, within the organizations who provide services, and also the planning and the policy at the policy level. So thank you, Lina, for.
This is Martha. I think Awa has a question.
Yes. Hello.
Yes.
Yes. My name is Awa Drame. I am a representative of Waskal and the Seattle Gambia Association. As a mother, my concern is the safety of using the buses and the trains, the rail, right? Because I have kids. So what did you guys have in place that will protect family members with their kids when they are in these bus or trains and being attacked? What did you guys have in place to protect them? If that happen or about to happen, will there be somebody in the train or in the bus to help, or what?
So I know on the trains, Seattle and just the transit service in general have been hiring more transit security officers. The guys in like the black vests, and I think it's green jackets. So there have been a lot of initiatives to expand them, but there hasn't been a lot for bus stops or buses. So in our recommendations, that is exactly to help protect families and children like you're talking about. We recommend having some of these new hire transit security officers to hop on some buses, you know, take some password bus routes, or install like in particularly more or areas where there's not a lot of bus frequency, or as many buses coming by, and it's just more rural, maybe installing like call boxes or blue light boxes, which have which are lit, and they have these buttons on them that you can press that will automatically link you to somebody in emergency services. So we suggest doing these things. They're not in place right now, though. So yeah, hopefully the study will help create some of that change and protect more from families and children, like you're asking about. Yeah,
Okay, thank you.
thank you. Yes, Martha, go ahead.
So thank you, first of all, PR Research, for all of your hard work, Sean and team, Anna and Tashi. So for those who don't know, like, we partnered, and I didn't hear the beginning, so you probably said it. And I know a lot of the leaders are on this call right now that were leading those focus groups of the data that was collected. And I just want to speak to, I see some questions regarding the language. Were there any major language barriers? And I do want to say that, as I think I know was already mentioned, the subpopulations that there was, based off of the leaders that have been involved with this project. They actually asked to add a subgroup. Our original group was elders and youth. And so we added the new migrants, which actually produced, I think, a lot of the data, because they were the largest group that we worked with. And that's where a lot of the major language or showed up. And we even found on that day, because there were so many of them, and we had, not the best of a facility to do that, that focused group, that it was difficult. You really need a researcher with each language translator to go into a separate room and to do it that way. And we just didn't have enough capacity. But yes, language is a major issue. And for someone who actually was working with the new migrants, myself, it is, as it was already alluded to, I think, by Anna in her presentation, when you don't have, and it's not even just about like elders, it's just in general, literacy is low when you go across the global, right, majority in terms of English. And so when you're not, if you can't read English, you can't really navigate. And so what we had to do, in a very like low funding situation at the church at Riverton Park with the new migrants, is we had to, create multiple language sheets to explain, different just basic commands. And so a lot of also sharing with audio clips of how to explain how to do things, instructions. And so I think, I know, I'm sorry, I missed a little bit of Lena's explanation, but I know that working directly with like navigators in language with the community organizations who are able to then explain like the routes. I know that PR Research came up with a really great instructions on how to, navigate transportation and some of the, basic rules. But again, it goes back to language access. And so if you don't have someone who understands your cultural, right, practices and your norms and what words translate effectively to that, community, it's hard to actually really learn how to navigate. And there's a lot of stories, I'm sure a lot of you guys may have heard of them, of people who are just newly to America getting on a bus and getting lost because there's no way of understanding. So really working with community organizations so that to teach that navigation and even how to use the app would be a really great solution, community-based solution to help learn, and get around in the different counties.
Yeah, thank you, Martha. Appreciate it.
There's a question in the chat about oh, Anna just answered.
Sorry, I might have just taken your answer.
No.
But yes, I'm sorry. I'm probably gonna mispronounce your name. Selene. Um, Yes, her question is, did the people that respond to the survey use transportation, and what categories or segments of the population was it? So Tassi can definitely speak more of this because she wrote down, or she knows the numbers. But we did collect data on this, and we do have, we took what people or how often people use public transportation and categorize them into a frequent, infrequent, or non-rider, really. And non-rider, I think, was maybe only used it once or twice a year or something. And then we were able to compare different things that people were concerned about based on how much they used public transportation. So we were able to see a lot of really cool trends with that, which I can talk about, or Tassi, if you would like.
Yeah, so there is divided out by ridership status. So frequent riders who basically relate to using it most of the week, or about 75% or more. Infrequent riders who are just sort of like, oh, if I'm popping over to the store or every once in a while. And then non-riders who noted that they just really don't use public transportation, or if they do, it's very rarely. And so we do have the data segmented out by those different groups as well. Mainly to look at kind of like the top concerns among each, and if that really had any differences between ridership status. We did not officially segment out by, certain demographics, for example, like disability, just because that made sure there's only like one person being mentioned. And so it's really hard to get like accurate data that way. But we do have it by those buckets, and that we have it between like age groups and ridership status as well. So those are kind of the subgroups that we looked at there.
Thank you so much. Thank you.
Yeah, thank you for your question. That's a really great data question. I love that.
Yes.
I think we have Nafisa. Nafisa has a question.
Yeah, hi, this is Nafiso Samater. I'm the director of Somali Independent Business Alliance, and I've been working with the Department of Ecology last 8 months, and we worked with people of color and refugee immigrant to make sure that they understand the air pollution and reduction of a zero emission. We educate around 400 different multicultural groups, online and in person. We went to faith-based community organization as well, church and different areas. And my question is, while we were putting the report together, we're trying to run the data, and it was really tough to find more data. I worked closely with Eric and another guy that I'm not remembering his name now, trying to help me and make sure that we collected as much as we could. It was zero data. So my question is, and we continue working with the ecology department, and as well, if we get other opportunity to continue educating. Now we're starting buying bikes, electric bikes, make sure that some of the community, few of the different community try to practice and see, like it's like a pilot project, we see how they like. So we got few. And my question is, putting the data together, since we don't have a King County exactly data, you think the survey you're trying to collect will help it brings more data? Is that the why you're doing this?
I think the part of the idea behind this is that a lot of community outreach data is behind a lot of barriers like language access or like literacy access, or even just like awareness that it exists. And so the idea behind this particular project, and really Martha spearheaded a lot of the grant writing with this on, and I think maybe they might be able to speak to it better. But the hope is to capture a snapshot of this particular community and identify needs that might not necessarily have otherwise been captured. And so the survey is just to provide kind of a background statistics to a lot of the stories that people are saying, so that when it comes time to talk to WSDOT or to file for these grants, we can say, oh, well, 75% of people, which in a pool of 367 people, it is a decent amount of people, at least within this context, have had a lot of trouble with like getting updated time on when the bus is going to arrive. That is able to create like an actionable, data-driven recommendation or request from the community. And I hear you on how hard it is to find data sometimes.
Yeah, just to speak on that a little bit more, from just the research perspective, while doing background research on all of this stuff, way back at the beginning of the project, it was a struggle finding background information. I think there was one UW study that actually, or it was a PhD dissertation from UW where it looked at subsidized transportation access. There really isn't a lot of academic work or data behind this. So really with this study, we were both spearheading and just aiming to just identify gaps of what are transportation barriers, what are transportation facilitators for the African diaspora community. And there just isn't a lot of even adjacent data for Seattle, King County, or for African diaspora communities in Washington State for transportation stuff. So it's really just trying to establish and fill those gaps. So future research can have a direction to go, and then it also gives a baseline for Seattle, King County, Washington State, other community or community and government organizations to have just a baseline to go off of and build off of, really.
Yeah, thank you. Just to add to what Tasha and Anna said, Nafisa, I think we don't have like really specific data, unfortunately, on kind of, awareness around the topic that you mentioned, or probably, the use of the e-bikes and stuff like that. But, if you have an idea, if you think like, there is a gap, we would love to discuss that and see how can we help. Yeah, thank you so much. I'll drop my email. I think you probably have. If not, then I'll drop my email there. Please feel free to reach out and we can see how can we work together to
yes, yeah, because while we were putting together those reports, we collected 95 survey, and our aim was like kind of finding out which area, like it was like a basic knowledge to understand the air pollution, because many of our culture don't understand how much is important for like air pollution or environmental, because they believe like they have more things that they could do than thinking about. That's like a listing they worried. So they were like housing, other stuff. So we were like a basic, and we collected 95, kind of like asking which area you may thinking, what type of housing, like diseases, kind of those stuff. So it was like really basic. But it was successful. I'm really glad that you guys continuing. We really appreciate, and if you put your email drop, I will, and I also put it our website and our information on the chat. So let's connect each other and see, and hope the 400 folks that we train, we only got 50 bikes, and we will see how we're gonna do that. Maybe raffle or maybe choosing. Make sure that they start following and understanding different transportation alternatives. So that's our aim.
Yeah,
Thank
fantastic.
you.
Yeah.
Thanks for inviting us.
Absolutely. I know people have lots of. Lena, you have a question. We're running out of time, but you can ask your question. Yeah.
Yeah. Last comment, one of the statement was stated that when you spoke with people that they have graduated from taking buses to shared transportation to a point where they use their own transport eventually. I think you share something of that nature. One of those people, I would love to use 128 bus. If I take a bus to go to work, it will take me 1 hour, and it's about less than 1 mile where I'm located by address. I would love to take the bus, not only for environment, but also tearing my car. I'm curious to know more about when people graduated from one point to other point, was it because it was expensive? Was it because of safety or other reason? Because I feel like those, for me personally, is the delaying of the buses and how many routes they take to get from 10 minutes driving to work to 1 hour driving with the bus. That way, it will help us kind of figure out a way of tackling the issue when it comes to why people are not taking buses. Was it financial? Was it only safety? Or was it the delay of the buses?
Yeah, so there's this research effect. Most of it was financial. And a part of it is also kind of cultural, in a sense. So there's this effect when any immigrant, it doesn't have to be America, once they enter a new country and establish residency, after a certain amount of time, they start to pick up more on the cultural traits of the country that they're living. It's not assimilation, that's not the right word for it, but it's that mixture of culture and trying to fit in with the place that you're living. So there's that aspect of it, and where we live, or the United States, is a very car dependent infrastructure. So exactly like you're saying, where it's more convenient to have a personal vehicle than to take public transport. And as people's financial situations change and they become more stable, they do shift to doing that, because you're right, it is more convenient. There were a couple of stories where it was like, I can sit and wait for the bus, but it takes me an hour to walk home, but I'm going to wait for the bus for an hour anyway. So I'll just walk home. But like, if I could drive, it would be great because it would only be like 10 minutes or something. So there were a lot of stories that amplify what you're saying. So it's both that financial factor of, oh, I have the money to afford a car and car payments, and then also infrastructurally, the United States is very car dependent, so that's just an extra incentive just in day-to-day life. It just makes it so much easier to go to the grocery store, load all your groceries in the back of your car, and then go home, than to haul it with you on public transportation. And then it's also wanting a little bit of that assimilation into the culture or the country that you're living in now, or that you move to. So like if you move to Europe, you might not have that same transition to a or to cars, because they have a more supportive public transportation system. If that answers your question. It's kind of a mix of things. Sweet. Love the thumbs up.
Thank you all so much for attending our event. We're running out of time. I hope we can continue this conversation. It should not really stop and end up here. As the report will come out early tomorrow morning, like basically around 10 or 11 o'clock. And then hopefully, you will have the chance to read through the report. It's really an insightful and beautiful report. Please help us disseminate the report and support our work. We will do our best to really bring the most credible data and community-centered data for better policies, programs, and services to serve the community better. We are always open for conversation and collaboration. And we thank you all so much for your support. If there's any question or you want to talk about some ideas, please feel free to reach out to us. Thank you all so much. It's end of the day, and you guys just did great. Really, thank you. Appreciate your time and your interest. Thank you.
And if you send us some
Thank
information,
you.
we could give you hints and maybe some support.
Pardon, Nafisa? Are you?
Yeah, I say if you send us email about whatever you think how we can contribute, we are ready to work with you.
Yeah, absolutely. I'll email you, Nafisa. We can continue. Yeah, I'll set up a call with you.
Thanks.
Yeah. Thank you. Thank you so much. You have a great evening. Thank you, Tasi. Thank you, Anna. I'm so proud of you guys. Thank you so much. Appreciate it.
Thank you,
Thank you,
everyone.
guys.
Have a
I
great
really
night.
appreciate you guys. Thank you, Anna. Thank you.
Thank you.
Oh
Thank
my
you,
gosh.
everyone.
Thank
Yes.
you.
And
Nice.
thank you,
Oh my gosh.
Martha,
I
and
was saying
Widinesh, and everybody
Yes.
in the community. We had
Thank you so much. You guys did a
some
wonderful
message at the
job. I
beginning. I
appreciate
hope
you
you
guys.
have the chance to see that. Thank you so much.
Thank
Appreciate
you.
it. Yeah.
See you guys. Bye-bye.